Hi, this is the sort of introduction to the Restart 19, a scientific study that was taken this summer from the University Medical Center in Leipzig in Germany. And the International Institute of Live Events is going to have a discussion on the results from the early findings from that investigation and the results that has come out of that investigation and how we can carry forward that information for event planners and event organizers within the UK and further afield.
Cool. So it's been a long-awaited results for the Restart 19 campaign to happen, and we'd like to know your thoughts, Paul, on the findings and the future of this research. So the first question we'd like to ask is, how has the research allowed the event industry to move forward and put on events?
Yeah, it's an interesting bit of results because it's the first of its kind that's been done under controlled conditions, and the methodology that was applied for this particular research required individuals to sign up to it, and they fell within a specific age range, 18 to 50. They had to be healthy and fit, so therefore they would have been tested, one would presume, and then sit in a arena, a covered arena, normally used for outdoor for sporting events. It was called a quarterback real estate arena in Germany. They were looking for 2,400 participants approximately. They didn't get the full amount. However, they did get a number of people that they were able to place in the environment. They put a band in there to play, and they wanted to look at the way in which people would circulate and move around that environment and what could therefore allow for the transmission rate of the virus, depending on how people would circulate within a given space over a given time. But this information does need further research, which I'd like to go into later on in the discussion. But in the early stage, it helps us to understand to some degree what measures we can put in place. And even though we know some events have taken place in the UK and in other parts of the world, it would be good to find out whether these things could happen in a real life situation.
Yeah, cool. So another aspect of it is, what, you've been a researcher as well, what do you think about the findings from the research and how will it help us move forward?
Yeah, it gave us an overview of the key results from the scientific study, and I'd just like to go through each one and give my opinion on the results, and possibly look at how further studies and research can be continued on the back of what's already been published. So number one, it talks about the total number of contacts lasting several minutes is relatively low during the event and can be considerably reduced through hygiene concepts. So we've seen that when you're in an environment, surfaces that you may touch and places that you may visit, and obviously people will also touch those same surfaces and visit those similar places, let's say food stalls, probably toilets or handrails, getting to certain parts of the venue. So these are potential places for the transmission rate of the virus. But what they were trying to say is that they're relatively low in terms of where you would spend several minutes in terms of the potential of the transmission of the virus having an impact on your health in that respect. So they said it's considerably reduced within that particular environment where they did the research itself. Number two, it says higher number of contacts occur during admissions to the venue and in the breaks. Thus, planning should focus on these aspects. So it may then transpire, and within some events, particularly sporting events, when they have a break and you can go and get food and you can go and get drinks, what some event organizers have been doing is to limit the amount of time that people spend queuing up or people spend at another location within the venue to get food and drink. So food and drink is then brought to their location, as was seen with some events that have taken place in the summer this period. And also venues now that are open for food and drink, they tend to all work around the basis of table service. So what he's trying to say is where people circulate and they circulate more within the intermission period, then obviously there's going to be a higher rate of transmission, and the event organizers should focus on those aspects to reduce the amount of time that people circulate if they can. Or I would presume, therefore, that there needs to be a level of appropriate cleaning of those areas to reduce the level of the spread of the virus. So the next point it made reference to is poor ventilation can significantly increase the number of people exposed to a risk of infection. Now, with most venues, and particularly modern venues, there should be adequate ventilation within those venues, be it a small club, be it a bar, or be it an arena, as was used for this particular study. So the movement of air within the actual location can significantly increase the number of people exposed to a risk of infection. So good ventilation would obviously reduce that. And I think to some degree, most venues can cater for that without too much problem. Point 4, it makes around 90% of the study participants are not put off by the idea of wearing a mask and are willing to continue to do so in order to be able to experience such events again. So the survey conducted following the concert experiment. So as it said, I mean, there are certain countries where it is mandatory, where you have to wear a mask, and you have to wear a mask in certain areas. Whereas in some environments, in some countries, and also in some working environments, they've talked about whether or not it's you could wear it, or you should wear it, or it should be mandatory. So there is a mixed approach in terms of the use of the mask, or when the mask should be worn, and therefore how does it really reduce the rate of transmission of the virus. So some control studies show obviously when you sneeze, and obviously in areas where you're breathing in close proximity to other people, the virus spreads and can be spread also through touching certain places where people have also touched. But they've also said it's also airborne, and if it's therefore airborne, then wearing the mask within certain environments, particularly where we're doing events, it should be mandatory while the virus is still prevalent within society. So that should be communicated to any attendee coming to the event, that they obviously must bring a mask. If they're not, then they'll be provided with one, and if they're not prepared to wear one, then obviously they can't enter. However, depending on any health conditions that they may have that can prevent them from wearing a mask, then that's something that needs to be addressed with the organizer and the attendee attending the event. The last point, in terms of the key results, it said if hygiene concepts are adhered to, additional impacts on the pandemic as a whole are low to very low. So wearing a mask is one. Obviously, the sanitization of certain areas on a regular basis, and obviously people who are handling food and handling, let's say, money, then the reducing the rate by which people handle money, and possibly work more towards contacts payments. And I know some venues stipulate that rather than the use of handling money. But also in regards to that, the social distancing that people must also adhere to. So these guidances now are already sort of prevalent around the world, and most people tend to understand them, and the majority of people tend to follow them. But it would seem certain events that do take place, and if it's in a seated arena event, then the 1.5 meter from you to the next person, and also the hygiene of those areas have got to be adhered to, as well as the people who enter the space, or when they go to the bar, or when they go to the let's say the lavatory, that they must wash, they must use a hygiene, and they must follow the specific guidance to ensure that they reduce the spread of the virus. So there must be a real push for the organizer and the attendees to follow the guidance while they're in the venue. and I suppose have people to oversee and watch and give advice and guidance to people as they circulate and move around in any venue to make sure there is a reduction of the transmission rate of the virus. So those are the key results that's come out of it.
Yeah. So from these key results, which they highlight the main 5 points, what are the next steps for the event industry to reopen, and like who would be in charge of making sure these um, aspects are adhered to?
Well, I suppose within our sector, we have a number of different licensing authorities, and we also have a number of different events and legislation that circulate around the type of events that we do. So it's not sort of one particular framework to fit all, but we do have guidance from the government and Public Health England, which can be circulated, and that in a sense can be a starting point for the event industry. But the event industry, in the same way that it wrote a number of guidance documents, such as the Purple Guide, such as the Yellow Books, such as the Red Book for exhibitions, then they can go forward and write another similar document that looks at the way in which events can start to reopen, working on the grounds of research done by the, the, the medical center in Leipzig, looking at the government's guidance through Public Health England, translating that down into the local authorities through the licensing department to the environmental health department, working with the HSE, and working with the various different associations and organizations that represents different parts of the event sector, and produce a document which is similar to what is known as the Purple Guide to most people who operate in the event industry. Seems to know what that document is. And I think if you get that written up, get it let's say some support from the HSC and support from other established organizations and government departments, then at least what we can do, if this virus is going to continue for quite some time, and I'm talking about probably for another year or so, then at least we have some sort of guidance that can help the industry move forward and start to reopen, and particularly in some areas.
Right. So one of the next questions we had was, do you think the research is conclusive for the whole event industry, or is it only for a certain part of it?
Yeah, it's definitely not conclusive for the entire industry, and we've got to be mindful of that. And this is just an early find in early studies, because it was done in a controlled condition. Whereas, as you know, with any sort of type of research, you would undertake the hypothesis, you look at the hypotheses, you do the research within a controlled condition, and you then go on and do the research within a real life scenario. So if they were to take this research and apply the methodology in a real life scenario and ask people when they came in, would be willing to be part of the testing and also part of the longitudinal study to determine whether or not when they entered the venue, would they download an app that looks at their track and tracing so we can identify where they are and operate with it when in a time when the country's in a lockdown, so you can really determine where those people have been once they've left the event and if they've been in contact with anyone else. So that way, while they're at the event, if they've come in and they've tested negative, because now they're saying you can get a test done in 24 hours or less. So when people before people arrive, they can get the test done and they can show that they are COVID free in terms of access. And then while they're at the event, they will do obviously follow the normal standards and the guidance that's been given for that particular venue in terms of the transmission rate that we now know. But when they leave, which is the key thing, is that they will then be part of the study to let them know that they will be contacted again to find out and then tested again to see whether or not there has been any transmission and if that transmission was a direct result of them being at that location. And I think till that's additional study has been undertaken, it is inconclusive to show how the transmission rate can really be affected within a real life scenario. But what we do know from this particular research, there are some standards that we can put out there. There are some things that we can do to mitigate the transmission rate it could be quite onerous, as was seen from the results, and people have to be very vigilant within the environment to make sure that people do adhere to them, and therefore they let's say potentially leave without contracting the virus and taking the virus onto another location.
Great. So this research mainly focused on the public in a live event environment, but it doesn't account for any of the backstage production or actually the emission sides of going to an event. Do you think this research is still required?
Yeah, it is, and I think, like I said, this is a really good start, and it needs to be followed up. And I think with any type of hypothesis, any type of research methodology that goes out to look at something like this, and for our industry, it is absolutely necessary, because we have 10, sometimes 50, 60,000 people at a venue in any given situation. So the backstage and the production people who come in and do the 2 or 3 day load in or the week load in and put up these stagings and put up all the equipment, how do they work, and how do you maintain their health and safety through that period? So yes, it definitely requires further research, and therefore will require funding that could either come from the industry directly, or from universities, or from the government departments, to really look at the way in which we can move forward on the social distancing. And I know with football and football clubs, they've been pushing the government quite vehemently to look at reopening, to get people back in stadiums following the guidance. Looking at the current situation and looking as we go into the end of this year, it would seem that we're going to go for a further lockdown across the UK. So that will hinder the opportunities for venues now and events to really go forward and open up in any way, shape, or form. But as we come into the new year, and if things and the transmission rate and the R rate does go down, then it may be worthwhile looking at a real life study scenario and seeing how that does affect people, following certain guidances taken from this particular study and guidances that we've got within this country. And and as we know, like I said, there are certain events that have already been following those guidance, particularly one that we published in one of our newsletters that shows what happened in Newcastle with the Virgin sponsored event, the 6 week festival, outdoor music festival.
Great. So thanks for your time, Paul, for answering these questions. I'm sure that the Restart 19 research project is going to have quite a lot more findings released in the next coming weeks as well. So we'll keep you updated on them. Is there anything else you want to add?
No, I'm looking forward to see the further publications on this research. And I think it will definitely inspire researchers across the event industry, particularly in academia, to then take forward this research, adapt the methodology, and receive certain funding, and allow that research to then circulate and push out appropriate guidance that we can then lobby the government, licensing authorities, environmental health, public health England, to show that we are a sector that can open up and go forward and begin to entertain, inspire, and create business and opportunity.
Brilliant. I think we'll leave it there. All right. Thanks for tuning in for this short podcast, and we'll see you on the next one.
Thank you.